I'm Farrar Duro, and you're listening to the PCOS Revolution podcast. And now it's time for our review spotlight. This review comes from Adarani. She is in Africa, and she says, I just recently got into podcasts and was out shopping for a channel that would talk about PCOS and the struggles. Now, this is a community I need for encouragement, even though I'm miles away in Africa. I'm learning from these podcasts so much. Thank you so much, Dr. Duro, for all the support. You don't know how far your work is traveling and impacting lives. We'll definitely email with my stories soon. And that is so wonderful to hear. I am so thrilled, Adarani, that you are listening to us so far away. And for you and for everyone listening, I would love to hear more of your stories. If you could send me an email at fduro@floridacompletewellness.com or go to our website and go to floridacompletewellness.com/contact. There's a contact form there, and I'd love to hear about how you're doing. If this show is helping you, if you changed anything in your life that's been beneficial, or some struggles that you're still having. I'd also like to mention that the PCOS Revolution podcast is supported by Florida Complete Wellness, providing integrative women's health care for nearly 2 decades. To sign up for your free consultation from anywhere in the world, or to get more information on our upcoming 6-week live workshop to help you kick PCOS to the curb forever, visit us at floridacompletewellness.com/PCOS. Now, on with the show. Well, hello, lovelies. I hope you're having an amazing week. On this episode today, I just wanted to take a little time to bring up a question that we come across every day in our practice, working with women with PCOS who are trying to conceive after being on birth control for several years. Now, I know it can be very confusing to figure out which route to take when you're trying to control your weight and you want to conceive, but you're told you need to take a prescription such as Metformin to control your glucose. So in today's episode, we're going to answer the following questions. Number 1, what effect does birth control and Metformin really have on our future fertility? And number 2, how does Metformin affect weight loss? And finally, what are some of the alternatives to it if you decide to go the natural non-medicated route? Okay, so are you ready to dive in with me today? Just remember to seek your healthcare provider's advice before switching up your medication routine, and always ask them to measure your labs before and after to keep a close eye on your insulin and glucose levels. Super important. So, okay, we are all familiar with the fact that doctors prescribe medication to merely address the symptoms of PCOS, but sometimes underlying causes are not looked at thoroughly. And yet a study of 657 women found that most respondents were disappointed by oral contraceptives or ovulation-inducing medications as standard treatments. And yet these drugs have been conventional PCOS treatment mainstays for over 40 years. And in fact, this was the most astounding statistic I saw. 99% of the study participants expressed interest in an alternative treatment if their condition could be safely and effectively helped by something else besides fertility drugs or birth control pills. So when it comes to managing PCOS, of course, we always say that, the first, the safest, and the cheapest treatment is always diet and exercise. So when we look at insulin resistance and how it responds nicely to increased metabolic activity, if that means weightlifting and getting your heart rate up, doing exercise, trying to aim for it at least 4 times a week, and eating right, of course, that's never a bad idea. It cannot be overstated that that's super important. And of course, like we talked about on previous shows, just losing 10 pounds can be the difference sometimes between getting pregnant or needing other advanced fertility technologies. But today I want to talk about the other ways that we can manage our PCOS symptoms that can be helpful. And what if you are taking Metformin currently along with birth control? And that's how a lot of patients come to our clinic as well. And there's nothing wrong with one approach or another. The main concern is knowing what the risk factors are and also how you can best support your body if you are taking prescription medication for PCOS. So These are important questions. And really, if you are taking birth control and metformin, and you're thinking about conceiving in the future, what things should we look out for? And let's just take a look at what metformin is, first of all. So, metformin is used alone or with other medications, including insulin, to treat type 2 diabetes. And as we know, diabetes is a condition in which the body does not use insulin normally and therefore can't control the amount of sugar in the blood. And metformin helps to control the amount of glucose or sugar in your blood, and it decreases the amount of glucose you absorb from the food that you eat and the amount of glucose made by your liver. So metformin also increases your body's response to insulin, and insulin's a natural substance that controls the amount of glucose in the blood. So it's not used to treat type 1 diabetes generally. And what you should know about metformin, of course, is that if you have some side effects such as gastrointestinal, which means some of our patients experience diarrhea and bloating, stomach pain, indigestion and gas, constipation, heartburn, headache, those can all be side effects of metformin, and especially in the beginning. So sometimes a lot of doctors will just recommend starting out on a really low dose, perhaps taking it in the evening and just going up from there. You notice that these symptoms are happening. You can talk to your doctor about ways to help with reducing those symptoms or how you should take metformin in maybe a possibly different way. So when we look at what happens also to our nutrient levels with metformin, an interesting thing has come out that metformin can cause a reduction in vitamin B12. And this is very important because if you're trying to conceive, low levels of B12 can also lead to miscarriage. So now, if we couple that with birth control can also decrease your B12 levels and B6 levels. So it's a double whammy, obviously, if you're taking both. And a lot of our patients are not taking a prenatal vitamin, or even if they are, they don't have enough B vitamins in the prenatal. It's only folate, really. It's just a bare minimal. Even the prescription vitamins don't have a whole lot of the B6 and B12, not nearly enough. If you are trying to conceive, getting off birth control, and still taking metformin. I always get asked this question, if you should stop metformin before or after getting pregnant. And obviously that's a conversation you need to have with your healthcare provider. And women who have PCOS, who are treated with metformin, do have better outcomes sometimes with conceiving and also during pregnancy, because that is helping to regulate insulin and glucose levels. And it's, can be very beneficial for a lot of women. I do want to caution a lot of women that it is not a panacea for weight loss, because a lot of studies that I looked at did not show really very promising results for weight loss. I think that the initial feeling is that because of the side effects to the GI system and the nausea and bloating and diarrhea, that definitely women did not want to eat as much because they didn't feel so good. And there is a little bit of a decreased appetite with metformin. So initially it could be helpful for weight loss, but it definitely should not be used as a weight loss treatment. And in fact, they actually over time showed that weight was gained back when the patients discontinued metformin. And they didn't see statistically a big weight loss benefit also when taking it, so beyond the first month or so. So just keep that in mind. If your practitioner has prescribed it for weight loss, it's actually not, that's not one of its number one uses. And there definitely needs to be some lifestyle and nutritional guidance with that, obviously, not just to think that is a cure-all. We also have the issue about breastfeeding. Is it safe? And with the research that I've looked at, it does say that it is safe to use it during breastfeeding as well. So I know we're jumping ahead of ourselves, but I thought that we should dive in a little bit to metformin, because originally metformin was derived from goat's rue. It's actually an herb from Europe, and it actually has many benefits, but it's also a toxic herb. So I always just thought how fascinating it is when we look at how toxic herbs actually are developed into pharmaceuticals, and then looking at the side effects of metformin. There are some great benefits to it, but there's definitely some side effects that we need to be aware of. So if we look at the outcome of women who took metformin during pregnancy, the infants were found to have normal birth weights, and at 6 months of age, the infants had normal weight, height, and social and motor development. But again, in order to look at the role that the nutritional deficiencies can play in trying to get pregnant, that's where we are a lot of times looking at this. The B12 deficiency can cause issues in and of itself. So I don't see that a lot of times women are tested for B12 deficiency, and I definitely think that we need to look into that. There was a study that was actually done in the European Journal of Obstetrics and Gynecology and Reproductive Biology in September of 2002. So it was a little while back, but as we are coming up on our recurrent pregnancy loss webinar on November 7th, I was doing research on nutrient levels in recurrent pregnancy loss, and I came across B12 deficiency being associated with early recurrent abortion or miscarriage. And what they looked at was that B12, folate, and homocysteine levels were checked in 110 women with unexplained pregnancy loss. And also, they looked at 96 women with one or more children and no abortion history or miscarriage. And when they looked at these, they noticed that B12 deficiency was definitely involved in early pregnancy loss. And they also recommended that the B12 assay should be done in women who have experienced recurrent miscarriage, and whether or not any abnormalities are present, other abnormalities. So I thought how interesting that this is often overlooked. When we are coming off birth control and perhaps still on metformin, there's definitely a high chance that we could have B12 deficiency. And when they talk about the miscarriage rates being slightly higher for women with PCOS, I just wonder if any of this is taken into account. So another big whammy with the B12 deficiency issue is that it can affect our mood. And there was a study done in 2009 about that in Poland, actually. And it actually looked at whether various mental disorders, such as depression, could be linked with deficiency of vitamins like folic acid, B12, B6, and omega-3s, and also elevated homocysteine levels. So they actually even looked at whether dementia could be associated with this as well. So I thought this was a really fascinating study. And the aim was to review the current state of knowledge about the role of folic acid and homocysteine in humans, as well as vitamin deficiency in the occurrence of mood disorders. So since PCOS is associated with anxiety and depression quite a bit, I thought that this study was particularly interesting because the results were this. They actually conducted a study that spanned over 17 years. And what they found was that in depression, folate, vitamin B12, and B6, as well as unsaturated omega-3 fatty acids deficiencies affected the biochemical processes in the central nervous system, such as folic acid and B12, and also the metabolism of something called SAMe. So this one is really interesting because they are the basis of the nervous system functioning. These neurotransmitters, such as serotonin, can contribute definitely to the development of disorders. So when we looked at these what the outcome was with this, they decided that B12 and B6 vitamins, folic acid, and omega-3 fatty acid supplementation is important in patients suffering from depression, and they really saw that this should be considered. So I don't know how often a doctor will test someone for their nutrient levels, such as B12 and B6 and omega-3 fatty acids, when they're saying that they're suffering from depression. So very interesting. And that wasn't the only study. There was another one that I found on that as well, that actually was entitled Treatment of Depression, Time to Consider Folic Acid and Vitamin B12. So if you've been on birth control for any length of time and you've never had your B12 levels checked, it might be very interesting to do that, especially if you're trying to get pregnant. So this study actually showed that both low folate and low vitamin B12 status have been found in studies of depressive patients. An association between depression and low levels of the two vitamins are found in the general population. And the study suggests that a high vitamin B12 status may be associated with better treatment outcome if you're being treated for depression. Very interesting, I thought. So I think that these definitely, in our patients, every patient who walks through the door gets a high potency multivitamin that is definitely has plenty of B6 and B12, along with vitamin D and omega-3, super important. So I really feel like our success with our patients can hinge on that. So if we see a lot of patients coming in just taking a standard prenatal, we actually tell them, this is how we do in our practice. So obviously everyone has their own way, but we tell them, can you please put that aside for a moment and let's just focus on a preconception vitamin that actually contains higher levels of B12 and B6 and vitamin D, so that we can look at supporting you preconceptionally. Now, when they get pregnant, it's up to their gynecologist, their OB, what vitamin they take. We do have a prenatal vitamin that still has a higher level than most of vitamin D and of the B vitamins. That's not found in a lot of prescription vitamins, but again, that's a different conversation, and we definitely think that it's very important to address these. Even more so, we look at a French study, and I know that you guys are going, oh God, these are study after study, but I really want to hone this in that when we're dealing with medications, whether it be hormone treatments or insulin regulating medications, we have to pay attention to the side effects and to what it's doing to our bodies. So when they looked at B12 and B6 deficiencies in women who've had pregnancy losses, they noticed that B6 deficiencies associated with preeclampsia, gestational carbohydrate intolerance, hyperemesis gravidarum, and also neurologic disease of infants. So I just, I looked at preeclampsia and what their recommendations were from this French study. This was done in 2016. And they really suggested checking the B12 and the B6 levels in women for vitamin deficiencies if you've had any issues with conceiving or any issues with miscarriage. So very, very interesting. And so when we're using birth control, going back to this question of what's happening in our body, and another study compared women who were taking birth control to women who were not, and they looked at their levels of homocysteine, folate, vitamin B6, and B12. And they found that the median levels of B6 and B12 were significantly lower in birth control users than non-users. And when they looked at that, they thought, well, this definitely needs to be taken into consideration. Why are we not told about this? I've actually had an argument about this with a gynecologist that, wanted to put me on birth control several years ago, and I was anemic at the time. And I said, think that that's going to be helpful for me because I know that it will lower my B12 also. And he said, no, that doesn't happen. So actually we see it in the research now that it has been documented. And that was several years ago when the studies were starting to come out. But this study that I pulled out was from 1980. So definitely it's been known for many, many years. And it's called, it was in the Journal of Reproductive Medicine, and it's called Nutritional Effects of Oral Contraceptive Use, a Review. So this is actually very interesting because it not only checked B12 and B6, but it checked other nutrients as well. And so they concluded that that birth control depresses the levels of B2 or riboflavin, B6 folate acid, B12 vitamin C, and also it can elevate levels of vitamin K, copper, and iron. Very interesting. And they also called for more research into this. So when we look at their conclusion was most investigators recommend that birth control users with vitamin B12 or vitamin C deficiencies should be given supplementary vitamins. We say go ahead and take that multivitamin anyway that has a little bit of extra B6 and B12, especially if you are taking metformin currently as well. If you're taking metformin and birth control, definitely. So what are some good alternatives if you are not taking metformin, or if you found that you cannot tolerate the side effects of metformin? We've actually come across berberine in our practice, and berberine is actually a substance that's extracted from certain plants, and it's super powerful, has so many benefits at lowering blood sugar levels, and it also reduces glucose production in the liver and improves insulin sensitivity. It's very interesting because a lot of studies with berberine have shown that it can lower blood sugar levels to a similar extent as metformin. And they actually tested this out on patients with type 2 diabetes. And when they gave them berberine, it lowered fasting blood sugar levels by 20% and A1Cs by 12%. So it's very effective at improving other markers as well. I mean, it leads to major reductions in total and LDL cholesterol. It can lower blood triglycerides and blood pressure levels. And that is great for a woman with PCOS. As you know, PCOS can definitely expose you to a higher level of cardiovascular risk. Berberine also has been shown to have an antibacterial effect too, and it may be protective against heart failure, cancer, and Alzheimer's. Super cool vitamin. I love using it in our practice. We've actually found a formula by Pure Encapsulations called Metabolic XR that contains berberine, and it is for glucose support. We have our patients take 1 capsule before each meal, and they actually do remarkable on it. We have checked their labs before and after. And with this, the most interesting thing that we've seen come out of this is that their labs no longer reflect PCOS state of insulin resistance and elevated glucose. So that is our number one suggestion if you are trying to regulate your glucose levels without metformin. We also recommend inositol, which also has a multitude of benefits, and especially if you're trying to get pregnant as well. The studies on inositol, I'm sure some of you guys have heard about, that it actually helps with decreasing insulin resistance, but it also can help with improving metabolic and hormonal patterns, restoring spontaneous ovulation. This is a new study. It was actually published this month, and I'll include a link to it in our show notes, entitled Inositol in Polycystic Ovary Syndrome, Restoring Fertility Through a Pathophysiology-Based Approach. So when we look at they studied the combination of myo-inositol and D-chiroinositol and which is a combination that we use called Ovasitol with our patients. But the effectiveness of that combination is pretty much twofold. It can help with insulin sensitivity, and also it can improve spontaneous ovulation as well as, an assisted reproductive technology. Inositol also improved ovarian stimulation. So I think that this is a great treatment option for PCOS. Obviously, there are many studies still going on about this, but it's one of the things that we definitely recommend to our patients with PCOS. And the nice thing about Ovasitol, these powders, is it's very easy to take. It comes in a little packet that you empty into water and take it with cold or hot beverages. Most of the time our patients take it with their smoothies in the morning, and you can have a little bit in the morning and before bed, and it tastes a little sweet. Actually, there's not much taste to it at all. So to sum it up, I definitely would keep in mind that there are alternatives to birth control and glucophage or metformin as the standard treatment for PCOS. Along with a healthy diet, exercise, taking vitamin D and multivitamins as well that are high in B12 and B6, getting a good night's sleep, and doing work on relaxation and stress reduction, this can be an excellent way to manage your PCOS without having to resort to the standard treatment of birth control and metformin. So I hope that helped. I really look forward to hearing from you guys. Please don't be shy. Send me your emails through our contact form on our website, or go to our Facebook page at facebook.com/Florida Complete Wellness. I also look forward to seeing some of you guys in the new year when we have our brand new PCOS workshop series. I hope that you all will join us for that. I really look forward to hearing from all of you. Have a great rest of your week. And that's the end of this episode of the PCOS Revolution podcast. If you've enjoyed the show and want to help me spread the word about how women with PCOS and hormonal imbalances can lead happier, more healthier lives, please head over to iTunes and leave us a review. They really do make a difference. If you'd like to have a question answered on the show or would like to recommend a guest, please go to floridacompletewellness.com/podcast. If you're on social media, you can follow me at facebook.com/Florida Complete Wellness and twitter.com/Florida Complete, where I post a lot of interesting research, webinars, and articles on our blog about really getting to the root of hormonal imbalances like PCOS. So it's a great way to stay in touch with the latest developments. Thanks so much for listening, and see you soon.